Welcome back to AM Northwest. Do you have dental insurance? And if you do, how much should you be paying for it? Here to explain the ins and outs of dental insurance, we welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Good to have you back again.
Thank you,
congratulations on your wedding.
It was on Saturday. It was the most amazing barn wedding, so I will have pictures to share in the near future.
Oh, good. Everything went well, so that's awesome.
Without a hitch.
Awesome.
Although we did get hitched.
There you go. All right, so let's talk about it. What do most dental insurances cover when it comes to?
Dental insurance coverage is dictated by dental insurance companies. Now, dental insurance companies, they are not charitable organizations. They are for-profit companies. So insurance companies really make money by not paying on claims and paying as little as possible. That's the best for their bottom line, but not for the patients.
All right, so what do you suggest then?
What I suggest is if your company offers dental insurance, then take it, absolutely. But make sure that the dental insurance allows you to see any provider. A lot of the companies these days are requiring patients to only go to an HMO provider, which means they can only go to one particular office. And these offices are usually huge corporations where they see as many people in a day, and it's very difficult to get an appointment.
Right.
And it's very difficult to get anything done there.
All right, and then what is the maximum dental insurance you can get?
So the maximum dental coverage is usually about $1,000 to $1,500 per year, which is interesting because it had the same amount of coverage in the 1970s and 80s when that $1,000 or $1,500 would cover a lot more.
Right.
So really dental insurance is just kind of a weird little savings plan where medical insurance is a real insurance plan.
Are implants covered? Because I know you do implants.
Implants and full mouth reconstructions are covered very little. A lot of what my patients need, they come to my office because their mouths are in not the best shape. And so when I kind of explain what they need and also kind of how much it costs, they're very surprised to learn that their insurance company is not going to cover it.
Right.
So,
and it affects their health, though you would think that dental insurance would cover it.
You would, and really all insurance companies would do if it mattered about your health would just be to take out your teeth and not give you really anything else.
Wow.
That's what they would do. Yeah.
And what about crowns and fillings?
Crowns and fillings are interesting because insurance companies do something called downgrading, where if you need a white resin filling, the insurance company will only pay for one of the metal mercury fillings, which costs less, and they actually make the patient pay the difference. And if you need a crown, most dentists now are doing porcelain crowns, but the insurance company will only cover gold crowns. So the patients are stuck with that bill.
So I'm just curious, what should you suggest to your patients?
What I suggest is that you need to do what's right for the patient. And what's right for the patient is not what the insurance company thinks. So a lot of times I need to give my patients the best, and most of the time insurance company doesn't always cover that.
Right.
It's basically just a small savings plan that doesn't cover a lot.
What do you think about private insurance?
Private insurance isn't the greatest thing because most of the time patients buy private insurance when they need a lot of work. But private insurance usually has at least 12-month waiting periods before patients can get this type of work.
Right.
That's so the insurance company can keep most of their money.
And contracted provider?
Contracted providers, a lot of insurance companies convince dentists to be contracted with them so that the company will funnel them patients, but they're required to take a 30 to 50% discount on their fees, and they can't charge that back to the patients. So what these contracted provider dentists have to do, they have to see more people in a day, they have to use cheaper materials, cheaper labs, and it's really a no-win for the patient.
Yeah. Well, there is a lot to find out here. I want to tell folks if they'd like to find out more, contact Sleep Dentistry Defined. The phone number is on your screen. We'll put all that information for you on our website at KATU.com. Thank you very much.
Thank you, sir.